name is Isabella Rees. My pronouns are she, her. I'm currently entering my last semester of my Bachelor of Science in Nursing, and I'm actually part of the honors program at my university, so I'm also doing some research there as well, and I'm in the process right now of submitting my first manuscript for publication. I also work as an undergraduate nurse at an inner city hospital, and I also work with a nonprofit organization that works with people with disabilities as well. I do some volunteer work in the area of youth mental health too for a local organization here, and then I also have a podcast and blog. The podcast I do with one of my peers who I'm a nursing student with, and then I started the blog a couple years back. It's just like a creative outlet for myself. I've always been really passionate about advocacy, and I see it as a really important role of the nurse, so I kind of have tried to intertwine that into my extracurricular activities and things that I like to do. So gender inequality presents in many different ways throughout the healthcare system, and it affects different people in different ways, obviously. So women who are in healthcare, speaking from a nursing perspective, definitely do continue to experience gender bias and discrimination from both colleagues and patients. Even though it's 2021, gender bias, sexism is still present, and there are still healthcare providers, healthcare workers who look down on female colleagues. It's not completely unheard of to have a healthcare provider who is known to have those attitudes and behaviors. Even personally as a nursing student, I've worked in environments before where more experienced nurses have told me, don't go to that person. He doesn't listen to nurses. He doesn't listen to female physicians. He only will listen to the male attendings. That's not something that is completely unheard of, which in this day and age especially, it should be. And unfortunately, those kinds of attitudes and behaviors really create a toxic work environment and dysfunction in the healthcare team, which then jeopardizes patient safety. So it's a huge problem in the healthcare system, and even when it's a known problem and there's someone who is known to have those attitudes, not much is done about it, unfortunately. So men who are in those positions of power, they're protected. And that's kind of a pattern that exists within healthcare, because even with patients who exhibit sexist attitudes, not much is done. It's kind of just accepted as that's part of the job, that's what you signed up for. Me as a nursing student even, I've already dealt with, sexual harassment, verbal abuse. There's nurses and physicians who have dealt with physical abuse as well from patients, and that's just something that's kind of tolerated and something that we're expected to accept. But in no other industry that I can think of are professionals expected to accept that kind of behavior. So yeah, I would say that gender bias is definitely present in both healthcare workers and in patients in the healthcare system, and it affects women who are healthcare providers and clinicians. It can be difficult for anyone to access healthcare services for sexual health because it's a very personal and taboo topic that people find it difficult to talk about, and you have to have a lot of trust with a healthcare provider to go into those types of things. And females actually carry a lot of the burden when it comes to sexual health and reproductive health, because we have birth control, pregnancy, pap smears. It just seems to be something that's a lot more relevant for people who have a uterus. So it's really unfortunate though that there is still stigma and problems related to gender that exist in the healthcare system related to sexual health. There is obviously a double standard in society when it comes to sexual health that, women who maybe have sex a lot or have a lot of partners are looked down on, whereas men who do those exact same kind of activities are praised for it. And that kind of infiltrates into the healthcare system as well, and there's still a lot of those kind of biases. And that doesn't mean that all healthcare providers are biased towards women, but it really doesn't take much. It only takes one negative interaction for a woman to then lose trust with the healthcare system, lose trust with healthcare providers, and to damage that therapeutic relationship. And that can affect whether she accesses sexual health care services again. And I think it's also really important to mention too that white women are really privileged when it comes to sexual health as well. Those social determinants of health, like gender, race, ethnicity, socioeconomic status, they all compound to affect people. And so people who are of racial minorities, ethnic minorities, maybe people who don't speak English, who are immigrants to Canada, they experience way more barriers and stigma surrounding sexual health than a white woman does. Like, for example, if you are maybe an immigrant to Canada, don't speak a lot of English, well, it's really hard for you to go walk into your healthcare provider and speak about any concerns you have with your sexual health when the only translator available may be your male relative. I personally don't really want to go talk to those things with my healthcare provider if my dad, my uncle, or my brother was in the room. But those are things that those people have to deal with. And we need to be able to put things in place to protect those people and so that they can access services much easier and that we can reduce those stigmas and those barriers. Gender bias really affects women in the level of care that they receive, their outcomes, how they're treated, how comfortable they are to access healthcare services. And women who are dealing with gender bias in the healthcare system, it's hard for them to advocate and speak up for themselves when they see it happening, because healthcare providers are in trusted positions and there is an inherent power differential there that makes it really hard to speak up when you see those kinds of things going on. And like I said before, it doesn't necessarily mean that these healthcare providers are overtly sexist. There's a lot of preconceived ideas and some subconscious biases that people have that affect the way that they treat women, and that, healthcare providers are no exception to that. Historically in medicine, for example, hysteria was something that was diagnosed in women all the time. A woman who was upset or in pain, she's hysterical. That's what they said. And that's not a diagnosis that we use today, but those same ideas still continue forward into modern medicine. And the research and stats prove that beyond even people's anecdotal accounts. Like, for example, there's been studies that have showed that women who have pain and report pain are less likely to have that pain taken seriously and be prescribed pain management, pain medications, compared to men who report pain. And that women are actually more likely to be prescribed sedatives rather than pain medication. And that suggests that their pain is more interpreted as an emotional response, as anxiety, more so than it is actual pain. And then that really connects to that whole point of hysteria being associated with women in the medical field. And on a personal anecdotal level, I have had more than one female friend who has gone to a healthcare provider and had serious health concerns, serious symptoms, and have been labeled as, you're just stressed out, it's emotional, it's psychosomatic. But I haven't had any experience of that happening to anyone male who I know. And like I said, that's anecdotal, but there's research and statistics that prove that that is an issue. The other thing that really impacts the level of care that women receive compared to men is gender bias in research. That, directly impacts patient care. Everything that we do in medicine is evidence-based and based on research. So when we have research that's very, very biased towards men, it has, impact on the way that women are treated. So standardized clinical guidelines for diagnosis, prevention, treatment, those are all based on a blueprint that was done of the male population. And the male and female body is different. So there's lots of examples of this. The one that people use most often is cardiovascular problems, because cardiovascular disease is the number one cause of mortality for men and women alike. But a lot of what we know about cardiovascular disease is based on men, and women present differently. So aspirin, for example, that's a medication that is prescribed regularly for people who are at high risk of having a heart attack as a method of prevention. But that prevention strategy is based on research that was done on men, and aspirin has been, proven to be effective in men, but it's actually proven to not be that effective, and in some cases even harmful for women. But it's standard procedure. Same thing with, diagnosing a heart attack. Women present with a heart attack much different than men. They don't have the Hollywood heart attack of, clutching their chest and having that left arm pain and sweating. It doesn't usually present that way. And because of that, women are usually, they can be misdiagnosed, they can be diagnosed much later, and that affects their outcomes. Women are 50 to 60% more likely to die of a heart attack compared to a man. And this is because they present with atypical symptoms, but even labeling that as an atypical symptom kind of suggests that the male presentation of a heart attack is the standard, because that presentation is typical for a female. So there's lots of examples like that. There's actually something called Yentl syndrome, which it's not a medical term, but it's kind of a term that's used to describe that phenomenon where women are often misdiagnosed, not taken seriously, not given proper treatment unless their disease presentation or their symptoms conforms to the same disease presentation that a male would have. And there's plenty of examples. Cardiovascular is only one. It also really impacts mental and behavioral conditions as well. For example, autism, ADHD, all of those things are very much based off of a male blueprint. This is how it presents in males. And because of that, there are a lot of women who go undiagnosed with autism and ADHD. So really, the gender bias in the way that healthcare providers treat women, as well as in research, really impacts women's outcomes and their ability to live a healthy life, unfortunately. For me, kind of a breakthrough that I had, I guess, in recent years was realizing the impact that internalized misogyny has on how I view myself and how I view the nursing profession. Nursing is really unique in that it is a female-dominated profession, and it always has been. When nursing first came about, it was not looked upon as a desirable job for a woman, at least not a refined woman. This was not something that a lady would do. You're being exposed to death, disease, bodily fluids, like horrific injury. They were on the battlefield healing soldiers before they were even allowed to own property or vote or have a bank account. So nursing is a really feminist profession, and it's really unique that way. But because it's always been female dominated, it's always been an oppressed profession. It's always been one that's looked down upon, even though there's been so many huge breakthroughs that have come about in the medical field because of nurses. Nurses have advanced the medical field so much. But even still, because it's a female-dominated profession and the stigma that goes along with that, today we still have the saying of, just a nurse. And it's still a profession that's can be looked down upon and doesn't receive respect that's proportionate to its importance, the education that's required, the knowledge required, the skill that's required for the job. And so that misogynistic attitude towards nursing that's always existed and persisted throughout history has an impact on even how I view nursing, even though I myself am involved in the profession. And I think it has an impact on how the public perceives nursing as well. Throughout history, there's been kind of different phases, I guess you could say, of how nursing's been perceived by the public. Like when nursing first came about, nurses were seen as like these angelic figures who were, saviors and caring for these poor wounded soldiers. and then it kind of moved on to like of a more maternal, caring kind of role, and then more modern, it's more of like a sexy type, role. That's how it's portrayed in the public, in the media. I don't know how it made that jump from maternal to sexy. That's like some kind of weird Freudian thing, I think. But and then now it's the meme all the time of like, the bitch in high school became the nurse, right? That's something that you always see all the time. And I actually, I challenge people to think about, was that girl in high school actually a bitch? Or was she just assertive and demonstrated leadership qualities and decision-making skills? Those are all qualities that are required for a good nurse, but they're also qualities that the misogyny in our society has labeled women with those qualities as a bitch. So it's interesting to see how the public views nursing and how that impacts our own view of ourselves as nurses, and how that can affect us. For me, at least, that's something that I've really noticed. I think that it's really important to make sure that you are educated on the social determinants of health and how those impact patients. That has been implemented into our curriculum, at least in nursing, and I'm sure in medicine as well, and other interdisciplinary professions. But the conversation needs to continue beyond school and into clinical practice. People need to make sure that they are staying up to date with that, with continuing their education surrounding those kinds of issues, health inequities, and diversity in healthcare. I also think that people need to take it upon themselves to reflect about their own biases regularly. Anyone can slip up. Anyone can develop biases over time that maybe they're not noticing. That's why it's really important to check in with yourself on that. And that's something that anyone can do. And then my advice to patients would just be to not be afraid to advocate for yourself. You shouldn't have to, and that's why I don't really like having to tell people that, but it really is so important. And even though it can be intimidating to advocate for yourself in a healthcare setting, just understand that you have a right to inclusive, compassionate, and high quality healthcare. And if you really feel that that's not what you're getting, speak up and get the care that you need. Be an advocate for change, for patient rights, and understand that you are the most important member of the healthcare team, and that you are an expert in your own body and your own social situation, and that your voice matters. Well, COVID has had a massive impact on healthcare pretty much across the board. It's been a huge stressor on our system, on healthcare workers. Patients have obviously been impacted in many different ways, and I think it's probably exacerbated some of the inequities that have already existed, and the barriers to getting healthcare that have already existed. I haven't personally been working with COVID patients because that's not the area that I work in, so I can't really personally speak to the bias towards women or minorities that has gone on as far as caring for COVID patients. But I can say that COVID-19 does pose a unique socioeconomic challenge for women that should be talked about. Childcare demands, for example, have gone way up since COVID started, and childcare, because of gender roles, is typically thought of as the woman's responsibility, and also because of gender roles, women and their careers are considered to be more dispensable. So a lot of women have had to give up their job, their career that they're passionate about, to do childcare, take care of the kids. And that has a really profound impact on women's financial independence, and as well as their own just personal well-being. The other concern that I think is really relevant to women is domestic violence. That's a huge women's rights issue. It's a human rights issue, but we know that it affects women disproportionately. So there's a greater risk of domestic violence out there right now because of COVID-19. And, we don't really know the long-term social impact that COVID-19 is going to have, just like we don't know the long-term physical effects that COVID-19 is going to have. So I anticipate that there will be research done on that subject, and maybe we'll know more about that in the future. And hopefully there will be research done to take a look at how COVID-19 affects different genders and minorities differently as well, because I think that's really important to consider. Healthcare is a government institution, and because it's a government institution, it was founded on colonialism and oppression of Indigenous people, people of color. And that can't be taken back. That is the foundation that the healthcare system was built on. So of course it still persists in the system today. Canada is only 150 years old. That's not a very long time in the grand scheme of things, and that's really only a few generations or degrees of separation from the present day. So all of those atrocities that occurred at that time, and really have occurred into recent history, the effects of that are still being felt. You know, people always have that expression of like, you know, a butterfly's flap of the wing can cause a tsunami across the world. Well, then what do you think years of oppression, hatred, abuse, genocide will do? That has huge impacts, that lasting impacts. So the healthcare system's relationship with people of color is strained at best, and there's bias that still exists in many healthcare workers, just as there is in the general population, and people of color still have mistrust in the system, and rightfully so. I've definitely seen racial inequalities in the healthcare system, especially working in an inner city hospital where I work with a lot of people who are under-resourced, and we know that because of Canada's history, Indigenous people are overrepresented in that population. And I think that, you know, the bias that exists in the Canadian population, it exists in healthcare workers too. Healthcare workers aren't exempt from that. In fact, I would say that, if anything, people who work in public service might be more partial to having those kind of views, unfortunately, because they do have interactions that reinforce negative stereotypes about Indigenous people. And in the absence of context, of, you know, knowledge and understanding about Canada's history with Indigenous people, intergenerational trauma, and social determinants of health, and the absence of empathy about those things, those interactions can generate a really hateful bias over time instead of what they should be generating, which is more concern for that topic and more, I guess, motivation to advocate in that area. And I think that's why it's really, really important that healthcare professionals are educated about Canada's history, about social determinants of health, and about the social sciences in general. And I think that there has been a lot of work done in this area. Like, I know from an education standpoint, you know, the nursing program has adopted an Indigenous health class, and university programs are creating spots for Indigenous people so that they can be represented in the healthcare system as healthcare professionals. And I think that's great. And, you know, healthcare agencies have implemented diversity inclusion councils, and they've had mandatory Indigenous cultural sensitivity training. And whereas before we used to only have pastoral care, we now have cultural consultants and Indigenous cultural consultants and Indigenous healing rooms in the hospital. Those are all great, but it's a process. These things take time. Just as it took time to cause that damage and it took time to perpetuate that bias in our society, it's going to take time to eliminate that bias in our society. It's going to take multiple generations of working towards those changes and implementing those changes. And it also takes a lot of self-motivation. Anyone can go to a mandatory, you know, cultural sensitivity class and sit through it and twiddle their thumbs and just be there because they have to be. But people need to actually care about the issue and take it upon themselves to learn and grow from those types of learning opportunities. And I also think that people need to step up and be leaders and role models in this area. You know, you see someone like Dan Levy, who, you know, saw the University of Alberta was offering a free Indigenous cultural class and promoted it on his social media and inspired thousands of other people to get excited about that class and to register for that class. You don't need to be famous to do that. You don't need to be famous to be a role model and to influence people who are in your inner circle and make that little extra bit of difference. So I think people should really try and make that issue important to them. And if you make that issue important to you, it permeates in the things that you do, and it makes you a little bit better, and it makes the people around you a little bit better. I would just say, I guess, to like summarize everything, that for women who are considering a career in healthcare, I just say, go for it. Women need representation in the field. We need people who offer their unique perspectives, especially women of color, who are willing to work towards positive change in the healthcare system. For anyone who's already working in the healthcare system, I just encourage you to really take these issues on and be accountable for them. Pursue further education. Self-reflection is so important, and really work towards being a positive change in the healthcare system that is so bent in its ways, and it's very difficult to change the healthcare system. But if those of us who are in it make little changes and are advocates in our own right, those changes can happen over time. And then I would just say to patients as well, like I said before, don't be afraid to advocate for yourself. You shouldn't have to, but the reality is that these biases still exist. So you do still need to advocate for yourself, and always be empowered in knowing that, like I said, you are the expert in your own health, in your own body, and you are the most important member of your healthcare team. So don't let anyone discount that.